Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So, as you know, we are now discussing about different cases regarding cough in children and infant. So, in the last class, we have seen one case where bacterial infection, the cough due to bacterial infection, which shows the very typical symptoms because the cough is not the main symptom there. Fever was the main symptom. Later, child was also started with the breathlessness. So that typically indicates a typical bacterial infections, and most common cause of the bacterial infection is a bacterial pneumonia. Now we will have another important case, case number 2. So as we know, in this case, the mother comes to you and the main complaint of the mother is cough. So what mother says is, cough is the main symptom. Okay, so this is the case. A two-year-old child came to you with mild fever and a severe cough, according to mother. So this is a complaints of the mother. So she says that my child is having very severe cough and he is also having a mild fever. So she says that on the day 1, the cough suddenly started, and on the day 3, he also started with a mild fever. So one thing is very clear now, cough is the one which started in the beginning, and that severe cough was there for 1 or 2 days, and then the day 3 the child also started with a mild fever. Now according to mother, this child has got such attacks previously also child used to get every 15 days, in once in every 15 days child used to get such attacks. So mother was very much bothered and also worried and also frustrated by this. And when you ask the family history, mother says that father and mother is not having such any histories, but grandmother is having some history of some dust allergy. So this is what mother says. Grandmother is not living with them now, but still she says that grandmother is having dust allergy. Okay, so as per mother, child is very active and playful otherwise. Okay, child is coughing very severely. There is some mild fever is also there, but still child is very active and playful and good, not sick looking. But it is often disturbed by the cough. Cough is disturbing his day-to-day activities. Otherwise, child is very active. This is what mother says. And now you done the examination. So when you see the examination, height and weight of the child is seen. The height of the child is 74 centimeter and weight is 11 kg. Now this is 2-year-old child. Okay, so for 2-year height is okay. 75 is expected at the end of second year, and is it at the end of the 1 year you expected 75 centimeter and weight is 11 kg. So height may not be up to the mark. Maybe 50 centimeter of the height will be at the time of the birth, and 25 centimeter increase. Let us see that. And weight is 11 kg. Weight is also 2-year-old weight is little less. Okay, it's okay. Let us see what is the case. Oh, now predominant symptom is always cough here. Predominant symptom is cough according to mother, because cough is very severe. Okay, so although she says that fever is there, she herself says that fever is very mild and not disturbing much, but cough is more disturbing. So the predominant symptom is always cough, and fever is mild. Cough started first. Another important thing is fever and cough, which started first. Cough is started first. Okay, so when cough started first, definitely it is not infection by the virus or by the bacteria. If it is viral infection, always fever starts first. Bacterial infection, always fever starts first, and then there will be cough. But this is opposite case here. Cough started first, and there is fever, mild fever, that too started later, and it is suddenly started. So according to mother, just a few days back, 2 days back, it suddenly started. So what is suddenly? A viral infection can occur suddenly. A bacterial infection may not occur so suddenly. It takes its own time, mild, and go on increasing. And so allergic or hyperreactive disease or allergic causes, so they can start suddenly. Okay, about the previous history, yes, there is previous history. Previously also child is having similar problems. Okay, then family history, grandmother is having problem. So family history is also there. A growth chart is almost all normal. I think the and the findings they are given, that is little bit incorrect. Otherwise the growth chart is normal. Okay. About the height and weight, whatever the values are given, I think that is wrong. Maybe some spelling mistake, I will look into it. So okay, growth chart is normal. Now we consider growth chart is normal, height and weight is not affected, it is up to the mark. Growth and chart is normal. So now the things are very clear, isn't it? Cough is a predominant symptom, fever is a mild symptom, cough started first, that also started very suddenly, there is previous history is also there, family history is also there, and growth chart is also not much affected. Okay, one thing is very clear, and child is playful in between and there is no much problems. One thing is very clear, this is not bacterial. Okay, this is not bacterial. Another is, now see, viral or allergic. Okay, if it is case of viral, fever would have been the first symptom. Okay, number one, fever would have been the first symptom and cough started later in a severe way. Second one is, there should be multiple symptoms. Okay, there is no multiple symptoms. Again, cough is there and mild fever is there, that's all. Only two symptoms are there. So there should be multiple symptoms in case of viral infection. Even the multiple symptoms are not there. So growth chart is also normal. So it is started suddenly, again indicative of allergy. It is also supported by the family history of allergy. So it may be a type of atopic allergies. So now here the things are very, very clear. So what is this? This is a case of a hyperreactive airway disease. This is a typical case of a hyperreactive airway because child is also having previous attacks. Okay, recurrently child is having the problem because of which the mucosal layer is get disturbed, the columnar epithelial cells are get disturbed, and as a result there is irritation, secretions quality is also decreased. So that means dryness is happening there in the mucus layer, and that is leading to allergic manifestations recurrently, and child is also having some familial tendency. That's all. So this is a hyperreactive airway disease. So what is important is determine the trend and follow up to find out whether it is atopic or non-atopic. Now you have to see whether it's atopic or not. If there is a strong family history is available, it is atopic. If the family history is not available, then it should be considered as non-atopic. That is the next course of the in the next course of the follow-up. So you have to determine all these things. Now if you consider the same in terms of Ayurveda, now this is a typical case of Vata Jakasa. Okay, so in the beginning it looks like when the severe cough and the severe chest pain and all the severe presentation is there, if you see Vata Jakasa, you will have the same presentation. There is no fever, but body pain, chest pain, and this thamba, etc., that will be more in case of Vata Jakasa. Okay, that is more in case of Vata Jakasa. Now, to some extent, even kapha vitiation may also cause this type of presentation, allergic presentation, because kapha is related to body immune system, and allergy is also actually a part of body immune system. So this may be a combination of Vata Kapha Jakasa. Now one thing we have left here is a fever. In this case, fever. Fever started after cough. See, okay. So actually, that particular fever is not because of infection. That particular fever is because of immunological cause. Because allergy is immunological cause, and because of immunological some interactions there, and there is some tissue damage taking place, and as a result, the fever started. That is also mild fever. Okay. Therefore, it should be considered as allergic fever. That's very important. Fever starting earlier, fever starting later. First there is a cough for 1 or 2 days, then fever started. It's not definitely infection. At least it is not infective inflammation. It may be a non-infective inflammation later. That's a different issue. Okay, so this can be considered as Vata Kapha Jakasa. And now you have to give the simple Vatahara and Kaphahara medicines. Nothing to do with here. Okay, so there is excess stimulation of the mast cells and the release of allergic substances. So that is because of the Vataja quality. Okay, because of pravartana of the Vata and Vatahara property, Vatakara property. And there is also some immunological issues may lead to allergic problems. Therefore, kapha should be also considered depending upon the symptoms. Okay, depending on the symptoms, now you have to decide whether it's Vataja or a Kaphaja, or sometime it may be both Vata Kaphaja, both Vata Kaphaja, and accordingly you have to treat. There are so many very important good medicines, effective medicines in Ayurveda for this like condition. One of the examples is Laghu Sutta Shekar. Simple tablet Laghu Sutta Shekar is a very good effect. Okay, it has got mast cell inhibition, incapacity. Another one is Shirisha. Any preparation of Shirisha, that is also very good for the any type of allergies. Okay, it has also proved for its mast cell stabilization effect. Okay, so anyway, so this is how we have got number of medicines. I'm just giving the glimpse, that's all. Okay, this is one simple symptomatic treatment if you want to give, that I have given. Otherwise, we have got a very systematic way of that we will discuss in the next class. Okay, we will in the next future classes we will going to discuss how actually we have to approach in terms of Ayurveda. I'm just giving one glimpse, that's all. Okay, so thank you very much. So this is a case of a hyperactive Ayurvedic or allergic cough because of allergy, and we have to treat accordingly. One of the important treatment in case of allergy is Nidana Parivarjana. Okay, so whenever the child is exposed to that particular triggering factor, the problem comes. Therefore, Nidhana Parivartana is one of the mainstay treatment, and then it should be followed by some of the Vata Hara and Kapha Hara treatment. So details are the same. We will discuss in future classes. Thank you very much for listening to me. Please don't forget to subscribe my channel, and also please give your valuable comments. And we will meet in the next class with another important case related to cough in children. Thank you very much.